nurse practitioner today.
Okay.
Today we will be performing a head-to-toe assessment. If at any point you experience pain or discomfort, please let me know.
Okay.
I will guide you through every step of the assessment.
Okay.
Before we start the assessment, are you having any pain or discomfort?
No.
Very good. I'm going to wash my hands. Now, before I begin the exam, I'm going to have you memorize 3 words.
Okay.
I'll have you repeat these words back to me at some point during the exam.
Okay.
So the words are apples, oranges, and pears.
Apples, oranges, and pears. Okay.
Very good. Okay, so the first part of the exam, I'm just going to take a look at your head and neck.
Okay.
Just kind of examine and check for symmetry. Okay, very good. Next, I will be palpating your head and your face around your neck.
Okay.
All right. Any tenderness?
Nope.
Okay, very good. Now I'm going to be palpating for your temporal arteries. Next, I'm going to palpate your frontal and maxillary sinuses. Please let me know if you have any pain or tenderness.
Okay.
Any pain there?
Nope.
Any pain here?
Nope.
Okay. Go ahead and close your eyes for me. I'm going to palpate your eyes. Any pain?
No.
Okay, very good. All right. The next step is I'm going to feel for your lymph nodes. All right. If you experience any pain, please let me know.
Okay.
So preauricular, postauricular, occipital, tonsillary, submandibular, submental. Go down the cervical chain, supraclavicular. Okay. Very good. All right, next, I'm going to just feel your jaw, okay?
Okay.
All right. Go ahead and open your jaw for me. Very good. Move it from side to side and clench your jaw for me. Very good. Next, I'm going to touch your face. Please let me know if what you feel is soft or dull.
Okay. Soft. 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 Soft.
Okay, very good. You can open your eyes now. Okay, next up, I'm going to have you do some motions for me.
Okay.
All right, so the first thing I want you to do is smile. Okay, very good. Can you frown? Okay, lift your eyebrows up. All right, close your eyes. Don't let me open them. Okay, very good. And puff out your cheeks. Very good. All right, next I'm just going to palpate your ears.
Okay.
And your right ear. I'm also going to inspect and palpate your neck and veins. Your trachea, thyroid. Okay. Very good. The next thing I'm going to have you do is I'm going to flash a light in your eyes, okay?
Okay.
All right, first I'm going to start with your left. Just look straight at me.
Okay.
Thank you. Next, I'm going to have you look at me.
Okay.
Okay, look at my finger. You're going to follow my finger with just your eyes.
Okay.
Very good. Okay, and follow my finger. Very good. The next thing I'm going to do is I'm going to get a little bit close to you.
Okay.
Okay. Then I'm going to have you cover your left eye. All right, and I want you to let me know when you see my fingers, okay?
Okay. I see. I can see.
All right, cover your right eye, and we're going to do the same thing.
I can see. I can see.
Very good. To examine the patient's optic disc and fundus, I would need to use an ophthalmoscope. I would hold the ophthalmoscope with my left hand and put it on my left eye and examine the patient's left eye. Then I would switch it over to my right hand, examine the patient's right eye with my right eye. All right. Next up, I'm I'm gonna go ahead and inspect your nasal passages. So I'm gonna shine a light.
Okay.
All right. The next thing I'm gonna be doing is I'm gonna ask you to open your mouth. I'm gonna examine your buccal mucosa, soft palate. Lift your tongue up for me. Very good. And can you say ah? Very good. Next thing I'm gonna have you do is I'm gonna have you stick out your tongue, move it from side to side, up and down. Very good. All right. So next up, I would examine the patient's ears. For this, I do not have an otoscope, so to perform that exam, I would pull the patient's ear upwards and back and insert a new tip into my otoscope and examine the tympanic membrane on both sides. Okay, I'm going to be performing a hearing test on you. I'm going to whisper some words in your ears and you repeat those back to me, please.
Okay. A, B, C. 1, 2, 3.
Very good. Okay. Next up, I'm going to be palpating your thyroid. I'm going to go posteriorly, so you're going to feel my hands on you. I'm sorry if they're a little bit cold. I'll try to warm them up.
Okay.
Okay. Okay, and at a certain point, I'm going to instruct you to swallow.
Okay.
Go ahead and swallow. Okay, very good. And swallow. Very good. Thank you.
Mm-hmm.
Okay, next thing I'm going to have you do is I'm going to have you shrug your shoulders for me. Okay, and don't let me press down.
Okay.
Okay, very good.